my name is Stacey Manion, and I am developing this video to help with people that are interested in becoming a general pediatrician. So yes, I am a female physician and I am a pediatrician. So basically, how does one become a pediatrician? You first must go to undergrad, medical school, and complete a residency. General pediatrics takes 3 years to complete residency. However, if you want to go into subspecialties such as infectious disease, gastroenterology, pulmonology, emergency medicine, anything like that, you can do that in a pediatric specialty as well. However, most of those are an additional 3 years. So you are looking about 6 years if that is something that you want to do. But hey, if that's what you desire, go for it. I wanted to be a pediatric hospitalist initially, and so general pediatrics was really all that I needed to do, and it worked out great for me. As a general pediatrician, you can do outpatient medicine, you can do inpatient medicine, or you can do a combination of both. What do I currently do? I currently am working in San Angelo, Texas, associated with Shannon Medical Center, and I do both inpatient and outpatient medicine. I typically start my day by going to see any of the newborn babies that have been born or any of my pediatric patients that may have been admitted overnight. So the way that our hospital system works is that we all take care of our own patients. So if one of our patients gets admitted overnight, then we are responsible for seeing that patient in the morning. So I normally do my rounds around 8 to 9, and then I start my office at 9 a.m. And then I see office patients throughout the day. And if anybody else comes in, like a new delivery, new baby, new pediatric patient that needs to be seen, then I would see them after my shift was over in the outpatient setting. However, if there was an emergency, then of course I would leave the clinic, go across the street to the hospital, take care of that patient, and then come back to clinic. We do have the flexibility to move our patients around or reschedule if need be. I used to be a pediatric hospitalist where I only did hospital medicine work, and that entailed usually 12-hour shifts. You would come in, we would only see patients that were hospitalized, anywhere from an asthma attack, new onset seizures, neonatal fever, anything like that. So there are multiple realms of general pediatric work that you can do. So what made me decide to be a pediatrician? I have wanted to be a pediatrician since I was 5 years old. I know a lot of people say they want to be a doctor when they are 5, but that doesn't always necessarily come true. But I stuck with my gut, and that's what I wanted to do, and that's what I became. I was very determined and strived to do what I wanted to do. For me, I shadowed my own pediatrician in 8th grade for like our career day. And in 11th grade, I shadowed a hospital. I have always desired to take care of children. I love children. It's my passion. Pediatrics is a different type of field, so you really have to want to go into that field. But for me personally, it was what I wanted to do. It was what I accomplished, and I'm happy that I am where I am today. What can you do to help you prepare for being a pediatrician or just a doctor in general? I think that science is a key aspect of any type of curriculum that you're going to want to do in high school or college. If your high school offers an anatomy course, I would definitely recommend taking that because that's going to help you with medicine in general. There are other courses in college, statistics, certain management classes, things like that, that could be beneficial as well, especially if you're going to open up your own practice or things like that. So you don't need to focus only on the science classes when it comes to undergrad. But obviously that's the foundation of medicine, science. There are multiple things that you can do while you're in undergrad, college, anything like that, to help prepare you. As far as like extracurricular activities, conferences, internships, those types of things. I like to stay active when I was in medical school, and I would participate in extracurricular activities such as soccer and softball, basketball, things, just to keep me in shape and just to do something outside of medicine and studying all the time. However, when I was in medical school, I joined multiple clubs, not just the pediatric club, but I was also involved in like the surgery club and like family practice and just other things, just to make sure that I was really doing what I needed to be doing. And I would do lots of volunteer work. I would, I would help out at health fairs. I also was involved in a specific program called Medical Explorers, where it was designed for high school students that were interested in the medical field. And we would actually expose them to all different types of medicine. We would have like suturing workshops, teach them how to do sports medicine taping for, ankles. We taught them how to use a slit lamp for optometry, dental moldings in case they wanted to go into the dental field. With that being said, they could ask all types of questions. They could follow us around if that was something that they wanted to do. So we did that. I was also involved in an organization called Read On, where we went to the local elementary schools and we just read books to children. Once again, being a pediatrician, that was very fun for me. And then I was also involved in something called Senior Soiree, which was it was developed by our honor organization, the Sigma Phi, and where we would go to local nursing homes and entertain the residents. We would do arts and crafts, we would sing, we would dance, we would just kind of keep them occupied, keep their minds young, and just have fun with them. So there are multiple things that you can do, multiple clubs, multiple conferences. I went to conferences for the pediatric club, for the surgery club. It's also a way for you to kind of connect, when you are getting ready to go on those residency interviews and all that. You will meet, attendings when you go to these types of conferences and things like that. So it's always good to get involved with those types of clubs and go to those conferences as often as you can. Of course, you're in medical school, so you do need to study. There are certain things that you can do to help you prepare for your exams. I, for instance, was involved in study groups, and I would study with my friends. In addition, our medical school had a note-taking service for all the lectures. I know some medical schools are like distance learning now, where you kind of do things on your own, but I was traditional, went to class, took notes, and being a note taker, I was one of the scribes. So that would always help me learn certain subjects, certain materials even better. So if that's something that's still available at your institution, your medical school, then I am a huge proponent of it because it helped me out. You can also stick to a schedule, make sure you're preparing for those exams. Don't just wait till the last minute. Study with your friends, read over your notes, do what works best for you. Me personally, I'm a new mom to a little 18-month-old little girl. And I have another baby on the way. We're getting a little baby boy this time. And you can still be a mom and have a medical career. That being said, you have to do what works best for you and your family, your type of career. I'm a general pediatrician. I have shift work. I can manage my schedule. I can do things a little bit different. If my kids, when they do start school and they have like assignments or they have little parades or little brunches and things like that, I can work around my schedule. Now, if you're a surgeon and you have medical cases to do, then that might not be as easy for you, but you probably still could make it work. I was also involved in research projects in both residency and as an attending, and that was more like chart reviews, and I was published in a journal when I helped out with one of those things. So, you have that to look back on if that's something that you are interested in. Just to keep your mind going or to help you better your career if you're trying to jump up the ladder in an academic facility or something like that. A lot of people always hear that dreaded question, how do you deal with the parents being a pediatrician? It really isn't that bad. A lot of children are unable to tell you what is wrong with you. So if you do desire to be a pediatrician, you have to really know how to use your physical exam skills to diagnose, because a 2-year-old is not going to be able to tell you exactly where they're hurting or exactly describe that type of pain if that's what they're coming in for. The parents have a general idea, and they're really, like I said, they're really not that hard to deal with. If you can just level with them on layman's terms, explain things to them, then they understand, and you will have parents that just, agree with you and understand you. However, if you're just telling them it's this way or the highway and are not incorporating, their religious preferences or other things, then yes, you might have some pushback. But if you level with them, it really is a very rewarding career, and the parents are not that difficult. What are some key points that I would like the audience to take away from this video? First and foremost, you need to be yourself. You need to go out and do what you want to do, whatever career that may be. If you want to be a pediatrician like me, I'm happy for you to email me, ask questions. I'm happy to answer any of those questions, but you just must be yourself. Don't act out. Don't pretend to be somebody you're not, or that career is not going to work out for you. Make sure that you are determined. You're setting your goals. You're doing your undergrad. You're preparing for medical school. You're preparing for those residency interviews when you get towards the end of your training. Preparing for the attending interviews. There are lots of things that you need to prepare for. Set goals. You can't just do it on the fly. You really have to be determined and set those goals. Make sure you get your sleep. Sleep is super, super important. A lot of medical students or residents have burnout because they're not sleeping. Now, there have been some rules for residency where you can only work so many hours that is helping out with that, but you need to make sure that you are getting efficient sleep, because that's going to make your mind better, you feel better, and you won't tend to make so many mistakes if you're not sleep deprived. And make sure you do what makes you happy, okay? Don't go out and be a medical professional because your parents are one and they're forcing you into that field. Make sure it's truly what you want to do, because medical school is a lot of work. It is a lot of money, and it takes a lot of determination. So you really need to make sure that it is something that you desire from the inside, and that is what you want to do. That being said, I'm happy to answer any further questions people may have. Feel free to reach out to me. Pediatricians is awesome. I love it. And thank you for listening.